Hi, my name is Christine Cooper. I'm an occupational therapist specializing in cardiopulmonary rehabilitation, and I wanted to go over some breathing techniques with you to try to help with shortness of breath and any anxiety. This is meant to assist your breathing if for some reason you are significantly shortness of breath and in need of medical assistance. This does not replace any medical assistance or seeing a physician that you may need. So the first thing I'm going to talk about is pursed lip breathing. Many of you have heard of this, I'm sure. It starts off with inhaling through your nose and exhaling through pursed lips. Okay, so the idea being that you're going to inhale for a count of 2 or 3 and exhale for double that length of time. So if it's easy for you to do 2 and 4, or 3 or 6. So I'm going to demonstrate now. So you're going to inhale, 1, 2, and then exhale. So again, I'm going to count with my fingers now. So that's inhale, exhale, inhale, exhale. Or you can do inhale for 3, which is a little bit harder, but if you're trying to work on your lung capacity a little bit more, you can try to do this as more of an exercise. So now I'm going to inhale, exhale, inhale, exhale. Okay, great. Now, those are 2 different strategies of doing that. Now, when you have chronic obstructive pulmonary disease, which is COPD, it's not the trouble that you have getting air in, it's actually getting the air out. So that is why the emphasis is on the exhale. So you want to exhale for twice as long as you're inhaling. It's almost like wringing out a towel. When you do dishes, wringing out that towel. You want to wring out all of the stale air in your lungs. So that way, the next time you breathe in, it will feel fuller and not short. That's where the term short of breath comes from, is not that you're not able to get the air in, it's actually reversed. It's that you cannot get the air out. So then the next time you breathe in, it feels like you can't get any air in because there's all this stale air left in your lungs. So it's very important that you try to practice this technique. Practice, I say, because then when you need it, when you're winded or anything like that, this is when you want to try to incorporate this breathing. If you're anxious, would be another time where you'd want to try to go back to this breathing pattern. It's basically something that you can practice so that way you can fall back on it. If you're out at a store, if you're at a restaurant, if you went up a flight of stairs and you're winded, then that's when you would want to try to go to this breathing. So it's something that you can physically try to control a little bit to try to calm yourself down into a breathing pattern that you can handle and let your body kind of regroup and come back. Okay, we're going to go over some other things. Recovery positions, resting positions. This is my goal, is to try to help everyone breathe a little bit easier, especially when it's humid out. You want to stay in a cool, air-conditioned place as well. So try these techniques as best you can. Try to sit in a comfortable chair, wherever's comfortable for you. Start off wherever it's easiest and you feel the best. So find that special chair, recliner, kitchen chair, wherever, and give yourself a few minutes every day, almost like meditation, to focus on this breathing. Sometimes people like to put on a bit of music, calming in the background. You want a nice calming environment. Okay, hope this helps. Leave your comments below if you have any questions. Thank you.